News Talk Sports for the Triad WSJS. Good morning, everybody. Happy Monday, the 8th day of the first month of 2024. I'm Jeffrey Griffin alongside Christian Snyder with the one, the only John Dunn with us. Hey, John, welcome back.
Good morning, Jeffrey. Glad to be back.
HealthTeam Advantage, right? It's a new year.
Brand new year, 2024.
And now, well, we're a week and a day in to the new year. So open enrollment period is in effect until when, John?
Till March 31st.
And what does that mean for folks?
Open enrollment period is only for people who are on a Medicare Advantage plan. Agents are not allowed to approach people to see if they want to switch plans. So CMS set these 3 months aside. Okay, someone signed up for a Medicare Advantage plan during annual enrollment period. They're not happy with that plan. It's not paying as they thought it should. They can reach out to their agent or they can reach out to the insurance company directly and inquire about switching plans.
Okay.
So they have these 3 months to do that if they feel like they made a bad decision.
Sure. And maybe it's that you thought it was one thing. Maybe you just didn't read your chicken scratch handwriting. That would be my problem right there. And you go and the copay is a different amount than what you were anticipating. Maybe you've been prescribed a new medication here in the first days of 2024. There can be a myriad of reasons to take in consideration, but it's not like you're locked in with no help available.
That's right. You've got these 3 months to make that switch to a plan that suits you better.
So another thing that 2024 brings in for a lot of folks, January 1st, you're now new to Medicare.
Yes. So, we're pretty much past this phase where we're able to help people who are already on Medicare. And now we're looking to those who are either aging into Medicare or maybe they've worked past the age of 65 and, now they're 67, 68, and now they want to retire.
Well, and there are a lot of ways that you can become a part of the Medicare family. So I thought today we just run down the list and you can help clue us in. What does all this mean? And what does it mean to be a part of new Medicare? So we'll start with the most obvious one. Now, all of a sudden, kaboom, you are 65.
Yes, so now you're 65. You are now eligible. This is the biggest group that's eligible for Medicare when they turn 65. And most people will get Part A of Medicare. We've talked about these parts in past shows, but they'll get Part A, which is hospital coverage, automatically. That you won't have to do anything. You'll get your red, white, and blue Medicare card in the mail. It'll show you Part A effective date. And that is of no cost to you as long as you've worked 40 quarters or 10 years throughout your life and you've had that Medicare deduction out of your paycheck. So people get that automatically. On top of that, you have Part B that's available at that point, but you have to apply for Part B, and there's a premium for Part B.
Okay. And together, those are what we classify as original Medicare.
That's original Medicare, Parts A and B.
And so Part B would cover things like?
That's going to be your when you go to the doctor, your outpatient services, those type of things.
I sprained my ankle, I need to go see
urgent
the doctor.
Care, yep. All of that would be Part B.
All right, so that's a part of it. And, of course, A is automatic. B, you have to reach out and say, yeah, I want it. What's my part?
That's right.
All right. And then there's the other side of that equation.
So the other side is now I've got A and B. What do I do? Okay. Once you've got A and B, you've got 3 months before those go into effect to apply for a Medicare Advantage plan.
All right.
The month that you turn 65 and then 3 months after. So you got a 7-month window to apply for a Medicare Advantage plan or a Part D drug plan.
So a better part of a year.
That's right.
So there's really not a need or a reason to panic. There is plenty of time to get in touch, do your research, gather information, and make an informed decision.
That's exactly right. So you got plenty of time to do it. Key, though, you don't want to delay.
Sure.
Right now we're seeing Social Security take about 60 days, and if you call them, they'll tell you, it's going to take us about 60 days to get all of this into effect. So don't wait.
That's 2 of your months.
That's 2 of your months.
2 of your months. So you're waiting, and you calling every day to the Medicare office is probably not going to expedite that process.
Not going to speed it up at all.
Okay.
So, you want to take care of those things ahead of time. Now, if you're going to continue to work and you're going to be covered under your employer's group plan, you're not required to take out that Part B.
Okay.
So you can let that go as long as you're going to be on an employer's group plan. Your group plan is also supposed to provide you a letter stating that what you have with the group is credible coverage. Okay. That's another key thing Medicare will look for when you apply for Part B later to avoid a penalty.
So do you have that letter? So keep that.
Keep that letter, yes.
Because sometimes, particularly with insurance kind of stuff, so you get so many notices.
I don't need that.
Right, I'm just going to lay it over. It's not important, but that's a big deal.
Huge deal.
Keep that letter. Put that in the filing cabinet.
Because it can be tough to get that years later, maybe when you will need it to prove that you had credible coverage.
And so it's not that we all love you, but it may not be enough to smile, look pretty, and say, no, I was working then.
That's right.
Okay.
That's exactly right. Yeah, so hang on to that. They're required to give you that letter every year when you re-up for your group plan.
All right.
So keep all of those on file because at some point Medicare will ask for a copy of that.
And you want to have it.
And you want to have it.
All right. So there you go, folks. So new to Medicare, and there's a lot more to talk about. All right. So, John, what if I leave my full-time employment? I've been working. I've hit the age benchmark, so I've cleared the 65 hurdle. But now I've decided we got bought out by another company. I've had it. I don't like the way we're doing things. I can be at home and have a lot less stress.
Yes.
All right. So you're leaving the world of full-time employment, and that would be your Part B.
That's right.
That you're getting through. So now that goes away. Then what's the next step, and what do you do then?
Okay. So according to the Medicare guidelines, once that group coverage ends, you have 63 days to get your Medicare in place.
63 days.
63. Isn't that an
arbitrary number?
It is.
But okay.
But that's just what it is to prove that you've had credible coverage, no gaps bigger than 63 days in credible coverage. That avoids any late penalty with Medicare.
All right.
Yep.
So you got it. Again, it's not a panic.
No.
You don't need to go beat down the door. But if you were one of those kids that waited till the night before to write your term paper, it's time to break that mold.
You got that right.
So let's go ahead and put the whole process in motion now so you are safe and secure and feeling good about where things are when time finally expires.
That's right. Now, if you're up against a hard deadline and you know that, I've got until the 1st of March or I'm going to get a penalty, your congressman's office or your senator's office is a great resource. If you're out past, that 60-day that Social Security is telling us it takes them to get a policy into effect with them for Medicare. Use your congressman's office or your senator's office to speed that process up.
Constituent services.
That's exactly right.
Can work a world of miracles.
Yes.
They absolutely can.
That's right.
So take advantage of that. And those phone numbers are widely available. That's not secret. And if you don't get anyone at the constituent services office, they are very responsive. If you leave a voicemail message with your name and your phone number, they will follow up and get in touch.
Yes,
That's
they will.
what they do.
Yes.
So good stuff. We've got a lot more coming your way. HealthTeam Advantage. If you want to speak with your personal health care concierge, get a little bit more information, then call 336-920-3648. Or if you want to talk with John right here in the studio, 777-1600. And the website to visit, HTANC. That stands for Health Team Advantage, North Carolina.com. It is 16 minutes after 9 o'clock. We're going to take a quick break. We'll be back with more of Medicare Monday on a Medical Monday on News Talk Sports of the Triad, WSJF.
Rise and shine.
Good morning, good morning,
Good morning. Good morning. It's Triad Today with Jeffrey Griffin.
News Talk Sports of the Triad, WSJS, 19 minutes after 9 o'clock. I'm Jeffrey Griffin along with Christian Snyder and John Dunn from HealthTeam Advantage. I'm going to give you the phone number. Now, you may not get John, but if you're a part of the HealthTeam Advantage family, your healthcare concierge will be available, or we can get you in touch with your healthcare concierge. They're available all the time, John.
They are available 7 days a week, 8 a.m. to 8 p.m.
So you don't have to, and why that's so important is you don't have to start over.
That's exactly right.
Somebody knows your situation, knows what matters to you, what your concerns are, and we keep extensive notes from all these conversations and everything. And the number to call, 336-920-3648. And it doesn't matter. You can call multiple times a day, every day if you want to, ask all the questions you want.
You're exactly right, Jeffrey. We are not on a time restraint with each call. We're not sitting there looking at the clock. Oh, we've been on this call 20 minutes. No.
Sure.
It's whatever you need as long as you need us.
Right. And if there was any confusion or misunderstanding, and maybe you want to have your daughter or your son or your spouse join in that conversation, you certainly can. And you're there, and we'll go over it until you understand it.
That's right.
So that is one of the many perks and privileges of being part of the HealthTeam Advantage family. And again, the website, HTANC.com. Talking about this new to Medicare campaign. What is new as of January 1st, 2024? We talked about for folks who have hit that benchmark, 65, for those folks who are working and have now left full-time employment, and they've got some different hurdles to clear. Now, John, what about people who were eligible due to a certain disability? And this is regardless of age, right?
This is regardless of age. So we've talked about the biggest group coming into Medicare, and that's those who are turning 65. But a big group that is overlooked are those who are on disability. So if you've been on disability for 24 months, that automatically makes you eligible to go on Medicare and a Medicare Advantage plan. There are two diseases that automatically qualify you for Medicare too, regardless of age, and that is if you're diagnosed with end-stage renal disease, you automatically qualify for Medicare and a Medicare Advantage plan. If you have Lou Gehrig's disease, ALS, that also qualifies you to go on Medicare and a Medicare Advantage plan. So we generally think of people, okay, when they turn 65, they're eligible for Medicare, but there's this other whole population that is eligible for Medicare as well. And a lot of people in those circumstances just don't know they're eligible.
But you need to, and again, do a little bit of research, and particularly, I mean, these are time-sensitive matters for folks with the end-stage renal disease and ALS, Lou Gehrig's disease. You got to find out. You got to become informed, and then you've got to take action quickly.
That's right.
Because you just don't want to leave. That is really, you can't push that aside.
Cannot.
And wait to do it later. And for folks maybe going, well, what is end-stage renal disease?
So I guess the easiest thing to look at is, okay, I'm on dialysis.
A lot of people on dialysis, right? So if you hear that, you don't want to jump in somebody else's pool.
You think about a family member or a friend that you hear that's going on?
You hear that in the neighborhood or at church and go, oh, well, you should call my friends at HealthTeam Advantage and talk about your Medicare Advantage plan.
You'll be doing them a great service.
Sure. And then they can sit down, and you all and the healthcare concierge can sit down and explain everything in detail and have this conversation.
That's right.
Because it is a change in your way of life.
Oh, completely.
And there can be some significant financial burdens if you don't have the coverage that you have worked for and are entitled to.
Huge. You're talking about events that can wipe out a life savings.
Sure. And not much time at all.
That's right.
So, all right. Now, folks, and you can learn more about that when you have the phone call, you have that conversation. You can get on the website and learn, HTANC.com. And then what about your new location?
Yeah, so we have, we claim in our tagline that we're local, accessible, and reliable. A key part of that is being accessible. So we have opened up a new retail spot. If you know where Palladium Cinemas are in High Point, it's right there in the little section between Wendover Avenue in Greensboro and Highway 68 in High Point. We're right in that area. With a retail location. We invite our members to come in if you want to see somebody face-to-face, look them eyeball to eyeball and have a conversation with them about your benefits or bill or anything like that. Stop by our office and do that. If you just have questions about Medicare, we have licensed agents on the spot as well to answer any questions that you may have, not just about a plan with HealthTeam Advantage, but about Medicare in general.
And do you need an appointment to drop in?
You do not need an appointment. Okay. We are there 9 a.m. to 4 p.m. Monday through Friday, so feel free just to pop in.
Now, is that the Samet Drive?
That is right. 5815 Samet Drive.
S-A-M-E-T.
That you got it.
I had to look that up, John. I thought, is this my southernese getting the best of me? Is it salmon or is it? But it is. I just be sure that's right. SAMET, 9 to 4, Monday through Fridays. Right?
That's right.
Because there are some folks who just maybe you're not uncomfortable being online or being on the telephone, and particularly for an older generation, nothing like sit down having a face-to-face conversation.
That's right. And sometimes it just helps to be able to have that paperwork right in front of you.
Yeah.
And you can just go back and forth with your questions much easier.
Because your healthcare concierge, you can say, are you looking here?
That's right.
But if you're sitting at the table together, going
You
over
just show it.
You put your finger right here and
Right
go, this
on
is what we're talking about.
That's
so,
right.
What is new to Medicare? You talked about folks with end-stage renal disease, and that number is always growing.
It's amazing. It's sad, but it's truly amazing how many people are on dialysis.
And John, there are some folks who, maybe I just didn't feel good, and go to the doctor, and 2 days later, they're at the local dialysis facility.
Yep.
And now they're in it. And so it can come upon you without a lot of warning. So don't feel like you're alone and abandoned.
No.
The folks at HealthTeam Advantage can be there with you, and they'll talk you right through everything.
That's
if
right.
you need to stop in the middle of that conversation and say, let's finish it tomorrow, we'll do that too.
We'll do that.
Right. And, of course, Lou Gehrig's disease can be a devastating diagnosis. Mm-hmm. And so you want to provide every form of resource and support that you can to the patients and the families that get that news.
That's right.
And so, again, the phone number to call, 336-920-3648, and the website, htanc.com. So when you get to the new Medicare, we talked about original Medicare, Parts A and B, and then you get to Parts C and D.
Yeah, so having Part A and Part B is you have to have those in place to get Part C, which is Medicare Advantage. That entitles you to apply for a Medicare Advantage plan. What happens is whichever company you choose for your Medicare Advantage plan, they take over your care from Medicare. So you still have your A and B, but now this insurance company is responsible for your benefits.
Okay.
And that's where HealthTeam Advantage jumps in. You know, being a local company, we're right here. You're not calling another state or overseas. You're calling right here locally. We can walk you through and explain to you exactly what all of that means. So with original Medicare, you have big deductibles. You have a 20% co-insurance that has no stop loss in place. So your 20%.
Now, what does that mean?
That means okay. You get just say you get a bad diagnosis, which can be devastating. Under original Medicare, whatever your medical costs are for that condition, you're responsible for 20% of all of those bills, no matter how high those bills go.
And that can add up quickly.
It can be. I mean, you know, in today's time, you can reach $1 million quickly. 20% of that's $200,000.
That's a lot.
That's a lot of money.
Right.
So a Medicare Advantage comes in, a plan like HealthTeam Advantage, and we have a stop loss in place of $2,900 for the year.
Okay.
So no longer are you looking at a $200,000 bill, you're looking at a $2,900 bill for, you know, something very catastrophic.
So you've opened the first envelope, it's impossible, and you feel panic setting in. You open up the second envelope, and
now
also
we're manageable.
It's breathe.
That's right.
It's stop and breathe. This is something that we can navigate together. We've got a lot more information coming your way on a Medicare Monday, on a Medical Monday with John Dunn from HealthTeam Advantage. We'll be back with more after this on News Talk Sports for the Triad, WSJS.
Jeffrey Griffin with Triad Today on WSJS.
News Talk Sports for the Triad, WSJS. Good morning, everybody. Happy Monday, the 8th day of the first month of 2024. Sunny skies today, looking at a high near 48. Boy, rain is on the way, John. Going to hit late tonight, probably about 3 a.m. We're looking at 2 to 3 inches of precipitation across the Piedmont Triad. Heavy at times. Could be some standing water in the morning. So be careful. Give yourself some extra time. Leave early. And looking at a high of about 59 on Tuesday. Wednesday, we're back to mostly sunny skies with a high near 50. So rain on the way.
I heard that driving in this morning.
You better believe it.
Yeah.
But this morning, we're talking about Medicare Monday on a Medical Monday, new to Medicare. And just to quickly review before we plow ahead, folks that are turning 65 this year,
Yes.
act now, 7 months.
You've got a 7-month enrollment window. That's right. 3 months before your date of birth, the month of your date of birth, and 3 months after.
And we
That
urge you don't
avoids
delay. Yeah.
that avoids any late enrollment penalty.
And so then there are folks who may have been full-time employed, even if they're past 65.
That's right. So we know today a lot of people work past the age of 65, especially since you don't get your full Social Security benefits until after 65 now. So it makes sense that people are working past 65. Some things to keep in mind. If you are one of those working past your 65th birthday, does the company you work for provide health coverage for you? If not, you need to enroll with Medicare. Like we said earlier, you're going to get Part A automatically, but you have to be proactive and apply for Part B. We have people who will stay with group coverage after their 65th birthday. A couple things to keep in mind with that. You are eligible to have Medicare and your group coverage. And then you get into some specifics with that. So if your group has 20 or fewer people on the group plan, then Medicare will be the primary and your group plan will be the secondary coverage.
Okay.
If there are more than 20 employees on the group plan, then it flips your group as primary and Medicare is secondary.
All right. So you will probably get asked that when you go into a doctor's visit and you have to just, here are my cards.
That's right.
Let's be sure. And they'll ask which is primary.
They usually will ask you which is primary, and you may not have any idea.
And if you want to know,
in that case, call
your healthcare concierge, 336-920-3648. Probably not the first time they've had that question.
Oh, no, not at all.
So, and
that's
don't
probably
be
daily.
bashful. Yeah, don't be bashful or timid. And if you didn't remember, well, that means you just like me. I don't remember either. So you tell them,
right.
Jeffrey and I need to know, right?
That is exactly right.
And John, this is for folks that are full-time employed. Now,
that's right.
What if you've got a part-time job, working down at the museum? I work down there 2 days a week for 4 hours each day. Does that impact?
Yes. So you will not be covered under that employer's coverage. You may be on your spouse's coverage.
Okay.
So there are a lot of moving parts here to think about when you're approaching 65. And that's why we encourage people to call us. Let us walk you through that process. Let us think about those questions you would never think about on your own.
Sure.
So, yes, if you're just part-time, you don't have group coverage under your spouse's plan, you've got to take care of that Medicare part of it.
And then also we talked about regardless of age, some folks with disability, and it can come on quickly. You can get a diagnosis and your world get turned upside down.
That's
so
right.
You don't want to put this off. And you're talking about end-stage renal disease. A lot of times that's defined by having to go to dialysis.
That's right.
A few times a week. Mm-hmm. And then Lou Gehrig's disease, ALS,
yes.
which is I think a lot of people are aware.
That's right. Those are the two diseases that will automatically qualify you for Medicare.
So that brings us to this question. Is there a bad time? What's the right time, the best time to start looking and doing your research and gathering information?
I think it's smart to start looking 6 months before your 65th birthday, just to look at what your options are, to give you plenty of time so you're not at the last minute trying to get things in place. And sadly, that's just where we find most people is, hey, John, I'm retiring next month. Well, have you? Then we start the questions. Okay, have you talked to Social Security? Have you taken care of your Medicare?
Right.
So, when you're 64 and a half, start planning for that.
Okay. Now, that also, and I don't mean to, when people call their healthcare concierge, I don't mean to make it sound like you have to be a part of the HealthTeam Advantage family already. What if I'm thinking about becoming a part of the HealthTeam Advantage family? Is that the same number and we can still have the same conversation?
Same number. We can have you get directed to a different group of concierge for that.
Okay.
So we have licensed insurance agents that will help you get ready for that retirement stage, choosing which plan is the best one for you. And then we have the other concierge, once you are a member, they'll answer all those questions about your health plan, your bills that you're receiving, and all of that.
So it's not a sign up, then we'll answer questions.
Oh, no.
It's the other way around.
We want to help you before you ever get into the system.
Sure. So go ahead, write down the number, 336-920-3648. So beyond the conversations, you should also drop in 5815 Samet Drive.
That's
High
right.
Point if you want
Stop
to do
by
it
and see us.
face-to-face. Sure. But then what other resources are available to folks that are trying to gather information to decide what's best for their family?
Okay, so we have tons of information on our website. One website that can be hard to navigate, but there's a ton of information there is Medicare.gov.
Okay.
Now, you have to remember the government has put this website up, so it's not the user-friendly.
It's a government website.
It's a government website.
I got it. Okay.
And it can be hard to navigate. So, once again, if you're at Medicare.gov and you're trying to get your account set up online with them and you don't know what to do, call us. We are very familiar with that website and how to get people signed up and registered at Medicare.gov.
So you can sign up and create that account online.
That's exactly
You
right.
don't have to go in and see somebody.
You don't have to, no.
You can, but those appointments, again, that is make a reservation, isn't it?
Well, you can just show up, and I'm going to say if you're going to show up there at their office, get there first thing in the morning.
In the morning. Yeah.
You may be seen by lunchtime.
May not, too.
You may not. You can call their toll-free number at Social Security, and you may be on hold a couple of hours.
Sure.
Or you can go online and take care of it in just a few minutes.
But then I think, now this is fantastic. We can call, and you all can jump in that conversation, and you can say, click here, click there.
That's right.
Because you all are familiar with that
That's
website. So it's not uncharted waters.
No,
You just
not
got to
at
ask
all.
the right person.
That's exactly right. You know, that we see that as part of our job is, you know, we don't want to just take care of your needs once you're a member with us and on a plan. We want to help you from the beginning stages, take the worry out, take the headaches out. Let us walk you through the entire process.
All right. And again, the website, I can give it to you a couple different ways. HTANC.com, that stands for HealthTeam Advantage, NorthCarolina.com, or you can just type it out, HealthTeamAdvantage.com. It'll both take you to the same place. Tons of great information. The phone number, 336-920-3648. And also, John, a lot of folks, you know, they'll have conversation with neighbors, with other members of the Sunday school class,
Right.
with their golf foursome.
That's right.
So let's go over this one more time. There are 4 parts to Medicare,
Yes.
A, B, C, and D. Let's just be sure that everybody knows, because somebody may say, well, I got my Part D. And everybody nods, but they don't necessarily know what that means. So A and B, original Medicare, that's your hospitalization and your basic doctor visits.
That's right.
Then we move on to the fun stuff, C and D.
That's right. So, like we said, A is hospital, B look at as outpatient. Then I'm gonna skip over C and talk about D. D is a prescription drug plan. The government does not offer a prescription drug plan, but they require insurance companies to abide by certain guidelines to offer a prescription drug plan to seniors. So there's some strict guidelines for them to go by. To get a drug plan, you have to have either Part A or Part B of Medicare. Once you have one of those or both, then you can get a drug plan. But then Part C, that's the fun stuff.
Yeah.
You have to have Medicare A and B to get C. And most Part C plans will include your drug coverage. They will include things like dental, vision, hearing coverage, gym memberships. Over-the-counter drug cards are popular now. So a lot of your Part C Medicare Advantage plans will cover what's required by Medicare, but then a lot of additional benefits on top of that.
Sure, and like your wellness programs, we've talked about this before, but we cannot overstate it. It's not just your physical well-being, but your social connections, your emotional well-being, your intellectual stimulation, that opportunity to connect with others that are in your same demographic.
That's right. It's the whole person that we look at. So much, you know, a lot of your physical health can be directly related to your social health,
right?
Your mental health. So we want to take care of the whole person. And that's what we look at HealthTeam Advantage.
It all goes hand in hand. So what is new to Medicare? Don't sit and wonder.
No.
And don't be confused. Don't be intimidated. Again, the phone number to call, 336-920-3648, and the website, HTANC.com. As we head to our final break of the morning on a Medicare Monday, on a Medical Monday, John, real quick, tell everybody again, we can't say it enough, the mission of HealthTeam Advantage.
The mission of HealthTeam Advantage, we do so much, Jeffrey, but the basic mission is to provide the best quality care, in your senior years of your life, so that those retirement ages can be enjoyable.
News, talk, sports for the Triad, WSJS.
Good morning. It's Triad Today with Jeffrey Griffin.
News, talk, sports for the Triad, WSJS. Good morning, everybody. Wherever you're going today, whatever you're doing, take us along for the ride. We're available around the clock, around the world, online at WSJS.com. And that's also where you can find our podcast. Our conversation with John Dunn from HealthTeam Advantage will be available at WSJS.com. Just give Christian a few minutes to get that posted after the big show today, and you can come back and revisit that. If you need phone numbers and the websites and all this, some of the information to review, it'll be there in perpetuity. I mean, you can access that anytime. The phone number at HealthTeam Advantage, 336-920-3648. The website, HTANC.com. And, John, we are in the open enrollment period.
Yes, we are.
And that'll run until?
March 31st. So open enrollment goes from January 1st to March 31st, designed for people who are on a Medicare Advantage plan that wants to change plans to another one. You feel like you've made a bad decision or you're not happy with the plan that you're on, CMS says we'll give you this 3-month window to try to correct that.
Sure. So maybe you've already had an appointment, you've picked up your first prescription of 2024, and the price was not what you were anticipating. This is the time where you should call and have that conversation.
That's right.
And say, why is it this and not that?
Right.
Right. So, again, you're a personal health care concierge at HealthTeam Advantage. Will talk you all through that. And so don't worry about it. Listen, whatever your medication is or your doctor, these are people that live in your neck of the woods. And that's also one of the benefits of being a part of HTA. They live in the same places, shop in the same stores, eat at the same restaurants, right? These are neighbors.
That's right. So we talked a little earlier about the new location we opened, and it's been interesting because I work out of there about every day myself, and it's been interesting watching members walk in and they actually get to talk to their HCC live and in person. It's like, oh, this is great. I finally get to put a name with the face.
I know who. I imagined you with a lighter shade of hair or something. But now we're all in it together.
That's right.
And so many plans are available through HealthTeam Advantage. I want you to talk about some of the benefits. Some of the. And these are questions that you should absolutely ask and think about with your family members and your company. What does this cost me? What does this cover? What does this mean?
That's right. So the first question that you should always ask is, what is my maximum out-of-pocket?
Okay.
Worst case scenario, what would be the most I would ever have to pay out of my bank account in a given year? Mm-hmm. That's the number one thing, because, insurance is about protecting your assets that you've worked your whole life for.
All right.
So I don't want a medical condition to pop up that's going to, wipe me out now. I don't have anything to leave family or friends. So what is my maximum out of pocket? That is a number that is manageable, that worst case scenario, I know I can take care of. So after you've established that, then the big things you get into is, well, what is it going to cost me for my prescriptions? Mm-hmm. In today's time that we live in, there's still some generics out there, but there are some name brands that are astronomical in their cost.
And you talked about with the Part D, and in Jeffrey E's, D means drugs.
That's right.
So it's the easy way to remember that.
Yes.
But then some parameters were put into motion, John, which kind of corrals the price, which was skyrocketing at one point for those dealing with a diagnosis of diabetes.
That's exactly right. So we have the affordable, what was that act that was put in 2022? It was the Inflation Reduction Act.
Inflation Reduction Act.
Yep. We get so many of those now. But That put a limit on what insurance companies could charge or make your copay for insulin. So those are capped out at $35 a month now.
Right. And you need to know that if you get that diagnosis.
That's right. So there's a cap on that. HealthTeam Advantage, we know that diabetes is on the rise in America. So we have a chronic special needs plans for those who have diabetes.
Okay.
And we have those insulins at a zero copay. So even lower than what the law requires us to have.
So some of those questions to ask. What is your maximum out-of-pocket deductible?
Yep.
What are your copays? And then you can find out, well, I've got this pill or that capsule.
Have your whole list right there. And we will go through the entire list and tell you what each drug will cost you when you go to the drugstore.
And then this is the doctor that I see, or I go to this office. Again, you call 336-920-3648. We can tell you that doctor's in our network or out of the network, and how would that impact what's covered.
That's exactly right. And that's important because you may see a PA at the doctor's office and not the actual doctor.
Sure.
Well, when you go to pretty much any insurance company's provider look up doctors online, you may not see your PA listed because all of that is done under a doctor's
name.
Call us. We're able to look at all of that and say, right, you're seeing a PA, but the doctor he reports to is in our network.
Now, if I turn 65 February 2nd, which is my birthday, by the way, but when I turn 65, you talk about the year deductible. Does that run from February 2nd to February 1st of the next year, or does this go from January 1st to December 31st of a calendar year?
That's right. It's calendar year. It all restarts January 1st every year.
So we're not on a rolling calendar based on your birthday.
That's right.
Folks, if you've got any of these questions or a ton more, the phone number to call, 336-920-3648. The website, HTANC.com, or the local benefit center, 5815 Samet Drive in High Point. And this is a local company, John.
Yes, we were started right in Greensboro by Cone Health. We're now owned by Cone Health and Novant Health jointly. So that's as local as you can get.
Right. You're not calling the other side of the country. These are people that know where you're going. They've been to the same pharmacies. They deal with the same doctors. So really, don't hesitate and don't wait. Get in touch with your healthcare concierge as soon as you can. John, great visit. Lots of wonderful information. That'll be available at WSJS.com. And we'll talk again in a few weeks, my brother.
All right. Sounds good.